So today we're going to be looking into the world of cutting-edge technology and medical treatments when it comes to surgery. So we're going to be shining light on gynecology. Gynecology. And in the intricate field of gynecology, there's also issues of surgeries. But today it's all about the minimal invasive surgeries. And in the studio with me is Dr. Kojo Apia-Kubi, who is an obstetrician and gynecologist at the Bank Hospital. Good morning, Doc.
Good morning, Chris.
How are you?
I'm well. Thank you very much for having me.
Thank you too. I can see you're all dressed in the Bank
In the
Hospital.
Bank Hospital, yes.
I love it.
I bring fraternal greetings from all the staff at the Bank Hospital.
All right.
To you and all your viewers.
Right. So you're a gynecologist.
Yes, please.
And what is minimal invasive surgery?
Okay, so minimal invasive surgery is where we use a camera with light to access various aspects of the body. And mainly we do this in order to make a diagnosis and also to treat patients based on whatever conditions they may come to the hospital with whenever they come and see us.
Right.
Yes.
Right.
So that's basically what minimal. So there are various aspects of minimally invasive surgery, and obviously we're going to limit our discussion to gynecology, which has to do with the conditions surrounding the female reproductive tract. So any condition which may affect the female reproductive tract. So we're looking at the uterus, or what we commonly call the womb, conditions affecting the tubes, fallopian tubes, or the ovaries, and we look at any problem that has to do with that. So if a patient comes with a problem that we suspect may have to do with the uterus, for example, the most commonest, as I'm sure most of your viewers will be aware, is fibroids.
Yeah,
so
fibroids.
We can use that to make a diagnosis as far as the uterus is concerned, whether there are fibroids there, how many fibroids there are. And then in addition to that, we can also use that to treat, so to remove the fibroids or to remove the uterus, whichever the case may be, depending on what the patient presents with.
Right. So what's the term keyhole surgery?
So yes, so minimally invasive surgery, as far as gynecology is concerned, we may enter into the abdomen or the tummy, the tummy of the patient, and then we also may go through the uterus. So with keyhole surgery specifically, we're talking about it's also called laparoscopic surgery.
Laparoscopic surgery.
Yes, where we go into the abdomen with small instruments. We make small incisions into the anterior aspect of the abdomen or the tummy. Again, to look into the tummy to see if there's a problem with any of the internal organs, as I mentioned, the uterus.
So that's what we're watching right now?
Yes, so you can see on the left, there's a camera that has been put in with a light, which is focusing on the uterus, the tubes, the ovaries, and then you can also see another hand there with an instrument, and those other instruments will be used to actually perform the surgery. So on the right, you have an actual live case where they've actually put in various small instruments through the small incisions, and they'll be performing various procedures through that. All right,
so they actually create the small incision, and then they put the tool inside.
Sure. So we'll create access. We'll use a knife to create access through the tummy, and then we first of all put in a camera to look inside the tummy, and then based on what we find, then we may put in additional, create other incisions to gain access into the abdomen.
So how does one know that, okay, you know what, I need a keyhole surgery?
Yes, so basically a lot would depend on what you're presenting with. So a lot of women may have pain, you may have bleeding, there may be something that has been picked up through imaging, some tests. So maybe the ovary is enlarged for some reason or the other.
So it's not just about probably fibroids alone?
No. So there's various things that we can do.
Can we name some?
So if we're looking at the ovaries may be enlarged. You may have a cyst within the ovary, which needs to be removed. Ovarian cysts. You can use the laparoscopic surgery to remove that. If you're looking at the tubes, I'm sure you've heard of an ectopic pregnancy.
Yeah.
So if there happens to be a pregnancy which is outside the womb and has gone into the fallopian tube, we can use the laparoscopy to first of all make a diagnosis, especially in those cases where it may be challenging to confirm whether it really is an ectopic or not. And then once we've been able to make the diagnosis, we can actually perform the surgery to remove the ectopic pregnancy from there.
Right.
Yes, so, and then we also have something called hysteroscopy, which is where we go through the uterus or through the cervix and look inside the uterus. Again, some patients may come with bleeding, and that may be as a result of some kind of pathology inside the wall of the uterus. So first of all, we'll use the camera to look inside the uterus and identify if there's anything of concern there. And if we do find anything of concern there, then we may remove that.
Wow. So have there been any complications when it comes to this sort of surgeries?
So every surgery has complications, unfortunately. And what we try to do is we try to minimize these complications as much as possible. So yes, most of the complications have to do with bleeding, and infection, and the likes. And obviously, the good thing about laparoscopic surgery is you have less bleeding as opposed to what you would find with a conventional procedure. So you're able to do various things in order to reduce or limit the amount of blood loss. So bleeding is one of the complications. Infection is also another complication. And again, the good thing about laparoscopic surgery is when it comes to infection, infection is limited because there are less openings that would gain access into the various organs to cause an infection. And apart from that, obviously, we would give antibiotics as well, just to limit that. Yeah.
Okay, so when it comes to laparoscopy, how many incisions will someone probably get? You know, like when it comes to like the traditional surgery, let's say a fibroid or something, you have to split through this way or that way to take off the fibroid.
Yes,
but with the laparoscopy, let's say it's a fibroid, how many incisions are we looking at?
So typically you are looking at about 4 to 5 different incisions. So usually you would have an incision around the belly button.
Okay.
And then some various other incisions along the abdomen, just so that we can operate. So the one around the umbilicus or the belly button would be used for the camera. So that's the main port that we would use, just so that we can look inside.
And they're all tiny, tiny incisions.
Tiny. So you're talking about 1 centimeter, half a centimeter to 1 centimeter sized incisions, which is very, you know, a lot of women they like the aesthetics.
We like the aesthetics.
They want to wear a bikini.
Of course.
When they go to the beach.
Yeah.
So it's good to try and limit the number of incisions and make sure that the incisions are very invisible, as invisible as possible. So that's the whole aim.
Right. So how different is it from the traditional routine?
It's quite different in the sense that...
I mean, we've talked about the type of incisions. What else?
Sure. So with the, of course, with a traditional surgery, you're going to make a large incision. The chances of having significant pain after surgery is also quite a lot because you're causing more trauma to the abdomen. Again, bleeding, infection, adhesions. So that's something that laparoscopic surgery tends to avoid. When we talk about adhesions, we are talking about, you know, we inflict a lot of, because of the handling, we touch a lot of things when we are doing an open surgery. That tends to cause some minor damage inside the abdomen.
So that's it, the adhesion in the cavity?
Well, this is a bit different. So this has to do with hysteroscopy, where we can go into, so this is one of the conditions that we would use hysteroscopy to treat, where we go into the uterus. For some people, they have adhesions inside the cavity of the uterus, inside the uterus, so that the uterus is actually collapsed. And that may pose challenges as far as getting pregnant is concerned. So this hysteroscopy would be able to put a camera inside the cavity in order to free up the adhesions from there. So adhesions inside the abdomen is what I was referring to, where we'll try and prevent those kind, because you have more adhesions being formed when you do an open surgery as opposed to a keyhole surgery.
Right. So what are the costs?
Big question. So costs, I wouldn't be able to give definite figures. It is slightly more expensive than what you would find with traditional surgery.
Yeah.
But there are benefits to that. If you consider the time that you spend in hospital, when it comes to laparoscopic surgery, you're spending within 24 hours in the hospital, you're home.
And you can go home?
You can go
the same day?
Yeah.
Okay.
Whereas if you're going to do a traditional open surgery, you're looking at 3-5 days. You're also considering how much time you're going to spend away from work.
3 to 6 weeks, yeah.
Exactly. Work is money. So
Yeah.
if you're going to spend more time away from work with the open surgery, you're actually losing more money as opposed to your keyhole surgery where you're going to spend less time during recovery. You get back to work quicker.
Yeah, right. So to viewers out there, I'm sure they're wondering, okay, why the Bank Hospital?
Well, the Bank Hospital is has a reputation for quality. It is one of the private hospital with international accreditation. So we are able to provide a quality service which meets the international standards. So that is one unique place that you can go to for any surgery, including laparoscopic surgery.
Right. Anyway, for women who might be apprehensive about surgeries and are watching right now, what would you like to tell them?
I think you should come. We would have a discussion with you. We would try and calm you down as far as surgery is concerned. I know a lot of women have, not everybody has their own fears and apprehensions about surgery.
Yeah, I want my eyes open.
You want your eyes open?
Yeah, I want to be watching everything.
Ah.
I have the fear
of during the surgery?
Yes, I have the fear of closing my eyes.
Okay, okay.
So I want to watch everything going. I want to watch, so that's my own fear.
Right.
I want to watch everything going on.
Right.
I'm that person, yeah.
Right. I mean, so unfortunately, when it comes to laparoscopic surgery, usually we do that under general anesthesia because of the discomfort you are likely to feel. So one of the things is that we usually fill the tummy with gas.
Ooh.
And that helps to create space.
Ooh.
Because, you know, as your tummy is right now, you're limited in terms of space to maneuver. So one of the things that we'll do is we'll usually fill it with gas in order to create...
So it becomes like a balloon?
More or less. But and when we do that, if you're wide awake, it's going to be quite uncomfortable.
I know.
So in order to, you know, alleviate that discomfort and pain, would rather not have you be awake during that period. But when it comes to hysteroscopy, that can actually be done whilst you are wide. And in some instances, what we've done is the patients can actually see what we're doing on the screen with us. So whilst we're actually operating, they can actually see what is going on.
Okay.
Yeah.
So where's the Bank Hospital? How can people reach out to you and so much more? So
the Bank Hospital is located in Cantonments. If you know where NAFTI is not too far away from NAFTI. That's where you'll find us on Shippy Road.
Right, right. Anyway, thank you so much.
Thank you so much for having me.
I'm sure the viewers really enjoyed this. I did enjoy this, and to everyone out there that is thinking, oh, do I need to do this? You should go and check them out. It sounds really simple to do. Instead of going through the 360 of having that big smile line down there, you should probably try this one because it's aesthetically pleasing, especially the times that we are now. Girls, you want to keep yourself? Yes, this is actually the kind of surgery you might need. So go out there and check them out. So we'll be speaking to Dr. Kojo Apiakubi, who's an obstetrician and gynecologist at the Bank Hospital. And it's been a conversation on invasive surgery, especially laparoscopy. I hope you enjoyed it. Remember that this is brought to you by the Bank Hospital.